Thank you for the opportunity to make a presentation. I am Takashi Suzuki from Kanagawa Cancer Center, Yokohama, Japan. I will now speak about intravesical prostatic protrusion is a risk factor for acute and late urinary toxicity in carbon ion radiation therapy for prostate cancer. There is no COI for this presentation. Radiation therapy is one of the treatment strategies for localized prostate cancer. However, as you know, radiation-induced urinary toxicity of the bladder and urethra can occur during or after the radiation therapy, which adversely impact patients' quality of life. There is a literature that states reducing high bladder doses may decrease the incidence of urinary toxicity. Carbon ion radiation therapy offers biological and physical advantages over conventional radiation therapy with X-rays. Carbon ion beams have an estimated threefold higher relative biological effectiveness than X-rays, and favorable clinical outcomes of carbon ion radiation therapy for prostate cancer have been reported. In terms of prostate morphology, these parameters are associated with rats or blue. However, the predictors of urinary toxicities of carbon ion radiation therapy are not elucidated. The purpose of this study is to predict the urinary toxicities in patients with prostate cancer treated with carbon ion radiation therapy in terms of prostate morphology. Study design and methods are shown on the slide. Carbon ion radiation therapy was administered once daily for 4 days a week over 3 weeks, and the total dose was set at 51.6 Gray in our institution. Toxicities were assessed according to the CTCAE version 4.0. Acute toxicities was defined as events occurring up to 3 months after the initiation of carbon ion radiation therapy, and late toxicity was defined as events occurring after 3 months. The worst toxicity grade was considered the final grade of toxicity. Prostate morphological parameters were measured by MRI or CT before carbon ion radiation therapy. IPP was measured as shown in the figure. Fisher's exact test was used for statistical analysis. Patient characteristics are summarized in the table. The median age was 69, and the median follow-up duration was 42 months. D'Amico classification and prostate morphological parameters are shown on the slide. There were 63 patients with an IPP greater than 0, which was 21.5% of all patients. This table shows acute and urinary toxicities in this study. Urinary frequency was a major symptom of the acute urinary toxicities. Grade 1, 2, and 3 hematuria were observed in 17, 1, and 3 patients, respectively. The presence or absence of IPP was significantly different between grade 0 and grade 1 and 2 for acute urinary toxicities, with odds ratios and relative risk of 2.4 and 1.9 respectively. Additionally, IPP was significantly different between grade 0 and 1 and grade 2 for late urinary toxicities, with odds ratios and relative risk of 2.4 and 2.0 respectively. prostate volume or transition zone volume was not significantly associated with urinary toxicities, and none of these parameters were associated with hematuria. In carbon ion radiation therapy, by gradually reducing the energy and repeating irradiation for each slice, the tumor can be irradiated from the most distal end to the proximal end of the target according to its shape. However, intravesical prostatic protrusion can be a potential risk of radiation therapy complications due to its morphological characteristics. In patients with similar prostate volume, the left shows the typical irradiation range for patients without IPP, and the right shows it for patients with IPP. In patients with IPP, you can see that a high dose of beam is applied to the bladder. The limitation of this study is that the incidence of urinary toxicities is based on self-reported interviews and lacks objective data. Further observation with a large patient cohort will be necessary to confirm our clinical outcome. In conclusion, IPP can be a useful parameter for predicting acute or late urinary toxicities in patients with prostate cancer treated with carbon ion radiation therapy. Thank you for your attention.